The following is not to replace or take priority over prudent medical advice given to you by your primary care provider. If you have questions or concerns regarding your health, you are encouraged to call your primary care provider. If you are having severe emergency symptoms, then contact 911 immediately or go to your nearest emergency department. Thank you. Greetings. My name is Dr. Jacob Curtis. I'm a board-certified family physician. I also have advanced training in emergency medicine and obstetrics. Today's educational topic is on the topic of sleep. I had the opportunity to give a TED Talk a number of years ago on this topic after having personal experience. I, like so many, had the perhaps less than correct attitude to feel like I could just push through, push the human body as much as it's capable of, and not sleep as much, but there's deleterious effects for us all, including myself. And so in recent years, I've done a lot of research and study and presentations on this important topic. So I've titled it, I'll Sleep When I'm Dead, and Other Fantastic Lies. It was Benjamin Franklin who once said, early to bed, early to rise makes a man healthy, wealthy, and wise. Although true in theory, most Americans are going to bed too late and also getting up early and not getting adequate rest in between. What are the deleterious, the harmful effects of inadequate rest on the human body? This picture helps to demonstrate some of the more common. It can decrease our reaction time. Individuals who've been awake for more than 24 hours have a reaction time comparable to somebody who's legally intoxicated from alcohol. It can increase the risk of depression, anxiety, and other mental health disorders. It decreases our immune system. Our body is so incredible that so much of that time in our sleep and rest is to help it to heal and to improve and overcome the taxation on our body from the day's activities. It contributes to increased obesity and overweightness. Our metabolism goes down. Our healthy choices might become less because we don't care as much, and so we're more likely to do things that are harmful to our body. It can in turn increase our blood pressure, increase our risk of other forms of heart disease. It can increase our risk of heart attacks and strokes, as well as our risk of diabetes. This picture shows some of the more tragic events that many of us are familiar with that have occurred in the last 40 years that were a direct result of sleep deprivation. You see in the top left, automobile accidents occur daily, many of which are attributable a high percentage of individuals who are asleep at the wheel or reaction time was compromised from inadequate rest. The picture underneath it reminds us of the tragedy of the Challenger explosion. It was a result of an exhausted engineering crew who, in a moment of tiredness, didn't change one of the valves that didn't allow proper exchange of gases, allowing the combustibles to not have the safety mechanism in place, causing the explosion. The top right shows us and reminds us of the Chernobyl explosion. Also, sleep exhausted and overworked engineers not catching something. The bottom reminds us of the Exxon Valdez oil spill that killed hundreds of thousands of oceanic life. This picture just reminds us of the complex neural circuitry of the brain. In English, our brain requires time to heal, much like a computer needs to be shut down at night and allowed to get software updates and reboot. Our brain is even more exemplified by the importance of getting adequate rest to do just that. So what are the tips to better sleep? Here's a list of some of my favorites that I share with my patients in my primary care office setting. Starting with creating a bedroom environment that is dark, cool, and quiet. Removing the distractions. We have so many things that stimulate our mind, projects that we hope to get to, things that cause stress and anxiety. We need to remove those out of where we sleep. Otherwise, that's going to make it difficult to fall asleep. This next is huge. We need to turn off our electronics. We're too connected. Oftentimes, we're in our bed, on our phone, computer, watching TV, maybe all at the same time, and we need to turn those off. Our brain is so incredible that it gets confused and mixed messages from ourselves. When we're in bed, our natural inclination is to go to sleep, but when we have these electronics, we want to stay awake, and so it can be confusing to our brains. In our circadian rhythm, now we're just supposed to turn over and go to bed. It doesn't always work that way. And so trying to remove electronics out of the bed, doing those things, it can even be to some extent in the bedroom, but not in the bed itself. And also trying to turn those off within 30 to 60 minutes before we go to sleep. Eliminating that blue light can have a profound impact on our ability to fall asleep in a timely manner. So we need to unplug. Having a regular sleep and wake cycle, we can actually train our circadian rhythm. Heart goes out to the shift workers. I was just talking to a colleague who's a night nurse, and his schedule is constantly changing. It is challenging. There's different things that can help. I'm a huge fan of melatonin, which the body naturally produces, can help us with onset, and especially with shift workers. But for the rest of us who have more predictable schedules, really trying to get in the same habit of going to sleep at an approximate same time every night and getting up around the same time every day. Other things, avoiding stimulants such as caffeine and tobacco, and depressants such as alcohol. Caffeine remains in the body 6 to 8 hours after it's been ingested. And so if we're taking afternoon caffeine and evening caffeine, that can make it difficult for us to fall and stay asleep. Tobacco is also a stimulant. Alcohol is a depressant that might help to fall asleep, but oftentimes when it leaves the system within 4 to 6 hours, it can cause individuals to wake up and have some sleep changes too. We've already alluded to this with electronics, but use your bed for sleeping only. Trying to keep pets off the bed. I might also add young children if that's avoidable. Also, wear sleep clothes. In other words, something that you wear that your body says, hey, this is what I sleep in. Some individuals who have motivation to get to the gym the next morning may think that they're being more efficient and can make a shortcut of wearing the clothes that they're going to wear to the gym, but that actually is confusing on our brain and can cause us some difficulty in falling asleep. So having a bedtime ritual, for some that might be prayer, meditation, mindfulness, a hot bath, reading a book, preferably not in bed, warm milk or chamomile tea. And also for those who have so much on their mind, which is many Americans, writing down things that you need to kind of decompress and get off your mind before, almost a thought journal. And what that suggests to the mind is, hey, I've already thought about this, addressed it, put it to the side, I'll address it in the morning. Or if you're trying to lay down, it's on your mind, just quickly writing that down and trying to get back to rest. And another trick I've learned just recently from a counselor, if you've been looking at the alarm clock, of course, move that away so it's not in your direct visual, but also just telling your body that if you look the other way, that's the position that you fall asleep in. And so kind of just cognitive tricks such as that can also help. This is a slide that just reminds us of those who have children at home, how much sleep they should be getting. Newborns, 14 to 17 hours in a 24-hour period of time. Infants, 4 to 11 months, 12 to 15 hours. Toddlers, 1 to 2 years. It goes up. You can see the slide in the demographics. And then adults really should be averaging 7 to 9 hours. There was a Cleveland Clinic study about 15 years ago that showed that adults will average 8 hours. Even those who are going by in 4 and 5 now, there'll become a time of reckoning that your body will need that time to catch up. And so it's best to get that now consistently until a medical emergency mandates getting more later. When is medical therapy necessary for sleep? As a medical specialist in sleep, I would add when the conservative and over-the-counter treatments have failed and no longer working. And so if you try to adopt those techniques, you're not falling asleep within 30 minutes after incorporating those for several days. You're waking up after you've fallen asleep before you should be waking up for the day and can't get back to sleep. There might be other factors that could be playing a role. Less well-controlled or treated depression, anxiety, thyroid disorders, possibly even heart disease or neurological problems. And so again, I just want to add my own personal experience that I know that sleep is important. It helps us to be our best. And so thank you for paying attention and participating with this educational program.